Good morning to you and a very warm welcome to the Big Issue segment. My name is Leah Ngari. Today we're talking about non-communicable diseases, and we're trying to get you to get involved in this discussion and get to find out what you do not know about non-communicable diseases. And with us is Greg Halen, who is a program leader at the International Development Research Center. As well there we have Mary Nyamongo, who is the Executive Director of the African Institute for Health and Development. Thank you very much for coming.
Morning, Leah. Thanks for having us.
Well, let's just begin by looking at what non-communicable diseases are, Greg.
Well, it's really a group of diseases. We generally refer to cancers, cardiovascular diseases, diseases of the heart and vascular system, chronic lung diseases, and diabetes as the main non-communicable diseases. Of course, we also include in that mental health problems as well. But generally, they're the chronic diseases that affect people over a long period of time and have a burden on their lives over a long period of time.
Okay. Now, when we say non-communicable, Mary, what do we mean by that?
This is opposed to communicable diseases. In Kenya and in Africa, we are very familiar with malaria, which is can be passed from one person to another, HIV, tuberculosis, and other conditions. But when you talk about non-communicable diseases, it just means that you cannot transmit the disease from one person to the next. And that's why Greg is talking about cardiovascular diseases, cancers, diabetes, that they're really also lifestyle driven. Depends on how you lead your life. And some of the risk factors we'll be talking about today include tobacco use, poor diet, harmful use of alcohol, and lack of physical activity. These are really how you lead your life as an individual.
Okay, well, let's look at the risk factors. Now that we've understood what non-communicable diseases are, what are some of the risk factors? Let's talk about tobacco. Yeah,
as Mary mentioned, I think the four main risk factors for these four disease groups are common to all disease groups, and tobacco is really the leading issue. Tobacco use is killing 5 million people globally each year. As a result of the proliferation of tobacco products across the globe over the last few decades. It's a very unregulated product, but we're trying to get on top of it through low-cost solutions right across the world that help to reduce tobacco consumption.
So when we talk about tobacco, what does tobacco cause in this case? What happens to the body? Mary?
Basically, when you smoke, and also in this country, you know, we have a tobacco control bill, and we have regulation towards consuming tobacco in public places, mainly because when you take tobacco, it affects your whole system from the head to the toes. And I think some of you are familiar with the WHO picture on how it affects the lungs, it affects the liver, it affects your skin, it affects your whole system. And it's not only the person who is smoking, and that's why we talk about the secondary smokers. If you sit next to a smoker, you get equally affected. So it is a product that has been shown through research to affect your entire system. So it doesn't only choose specific elements of your body or specific parts of your body, it affects your entire system, and maybe Greg can talk a little bit more about that.
Well, of course, the leading problems related to tobacco are cardiovascular diseases, diseases of the heart, and the vascular system, what it does to your arteries and veins, and also a leading cause of stroke. It also causes chronic lung disease and cancers, of course, particularly lung cancer. But it's not just a health problem, of course. This is a problem of poverty. Poor people are actually spending money on tobacco in preference to food because it's an addictive product that is marketed all over the world. And as I said earlier, it's under-regulated, and there's a lot we can do to regulate the product and make it less affordable, less available, and less appealing to young people and those older people who are already smoking.
Well, let's look at the next one. You've mentioned there are 4 main risk factors. We've just talked about tobacco. What's the next one?
Well, the other major issue is unhealthy diets, the overconsumption of obesogenic foods, as we refer to them, foods that make people overweight but are low on nutrient value. This is a major cause of diabetes and cardiovascular disease, stroke and cancer. Once again, all 4 major non-communicable diseases. And this is also happening across the world in low and middle income countries. It's often a myth that this is just an issue of wealthy countries where people have more money and can consume more. But this is also affecting poorer people in low and middle income countries, and even in countries where undernutrition is a problem as well. So we have this burden of both diseases that are going to cause major costs to our health systems.
Well, Mary, right now is the time we're seeing Kenyans embracing the lifestyle of having fruits in your diet. You know, in the morning you take a fruit, in the afternoon, and people are now getting to learn more about the need to include fruits in your diet. What would you say is the situation in our country, especially when it comes to unhealthy lifestyle?
This is becoming a real major problem, and Greg talked about the situation where you're having a double burden, where you're having undernutrition. 30% of our children are malnourished, and we are seeing 30% of our children are overnourished. They're taking too much energy than they need to use. Greg talked about having access to unhealthy diets. We are seeing a proliferation of steers, fast food. Children are really happy when you have all you can eat, all you can drink, too much sugar, too much fat, too much salt. So in this country we are having to deal with both, where on one side we have communities where children don't have enough to eat and adults don't have enough to eat. We have on the other side people who are eating too much, and therefore you're getting children having diabetes early on in life. We are seeing a lot of overweight people in this country. The recent demographic health and survey actually estimated around 40% of women in Kenya, in Nairobi, are overweight or obese. That's a real high percentage. And as Greg just mentioned, then we have higher risks of heart and stroke. We are at higher risk of hypertension and the other non-communicable diseases. So our lifestyle, even though we want to see people eating more vegetables, people eating more fruits, it's sometimes more expensive to access good fruit and nutritious vegetables. For instance, if you want to buy an apple, it's 25 shillings. How much is a bottle of Coke? How much is a bottle of quencher? And just the costs are also a bit prohibitive. Bananas used to be 5 shillings. If you walk down the street, a banana is 10 shillings. And that's sometimes too expensive. You need 2-3 bananas to get full. And yet with 30 shillings, you can have access to a packet of French fries. So the cost of fruit, although is desirable for us to eat more fruit and vegetables, sometimes it's prohibitive.
Okay. Well, remember, you can be a part of this discussion by calling us through the numbers that will be running on your screen. You can also send us messages through the numbers 2101, or you can drop us a comment on Facebook. The group name we're using on Facebook is K24. Remember, you can be a part of this discussion again by calling the numbers that will be running on your screen, or dropping us a comment or sending us a message through the numbers 2101, or dropping us a comment on Facebook. The group name we're using there on Facebook is K24. Well, unhealthy lifestyle. I want to focus much on unhealthy lifestyle. I know tobacco, not many people smoke, even children. But like you've mentioned, children are affected when it comes to unhealthy lifestyles. So how then, Greg, do you think a country like Kenya can encourage especially the young ones to eat healthy? Because a majority of them, like you said, Mary, they enjoy fast foods, you know. When they can have 2 bottles of sodas, they're happy. But how can parents begin to instill that culture of a healthy lifestyle in their children?
Well, as you've referred to parents, certainly the culture and the the family situation does have an impact, and I think in this day and age it is important that people become more aware of the situation, that parents are empowered to be able to provide a supportive environment within the home to be able to provide good access to excuse me, good food and nutrition rather than the less healthy products. But this comes down also to their access on a daily basis to the unhealthy products and the healthy products. Now, so there are things that governments can do to regulate that food supply and make the healthier products more available and more affordable. You know, the food that children have access to at school, on the way to school, on the way home, and when they get home makes a difference. The choice of products, nothing influences the choice of products in the market than price, more so than price. Now, if the healthier products are cheaper than those less desirable products, the unhealthy products, then that's what will be purchased more often, and that's the sort of thing we need to. The low-cost solutions really include things like the regulation of price.
Well, let's look at some of the diseases, the non-communicable diseases that come about from unhealthy lifestyle. Mary, let's begin with you.
See, one of the key risk factor we're looking at is unhealthy diets, as we said, and an area of focus has been salt consumption, for example. And if we look at what's happening in Kenya, although we really know that a lot of the cooking takes at home, a lot of the food we eat is produced in the houses. Unlike the West, and Greg may talk about that later, where there's a lot of pre-packed food and access to foods from the supermarkets, we add salt at home. Do we ever stop to think how much salt we are adding in our food in the houses, how much Royco we are adding in our food, how much Maggi cubes we then on top of that put chicken masala, how much salt we are adding at home? And yet salt has been identified as one of the key sodium has been identified as one of the key areas of concern in terms of consuming a lot of as a risk factor to hypertension. So if we are going to manage hypertension, and by the way, through research that has been done, through screening that has been done, a lot of us have high levels of hypertension, but we don't know we are hypertensive. Out of 5 people who are screened, if you just do mass screening, 4 out of 5 don't know they are hypertensive. So essentially we are consuming food, we don't know what's doing to our bodies, we are using too much salt at home, we do not know we have too much salt, and therefore just beginning to ask ourselves, where is our source of salt? How much are we consuming? And what can we do to reduce the amount of salt we are taking, the amount of sugar we are taking, the amount of fatty food we are taking? We begin to take control of our own health, our own diets, and therefore begin to address some of the risk factors that we talked about. And unhealthy diets is one of the key risk factors. We're also talking about physical activity. As we move from rural areas into urban areas, we really do not have an opportunity to walk to work. We do not have an opportunity to exercise, and we sit most of the time. Some of us will sit in offices. We go into the office in the morning, we sit in the whole day. We have access to snacks sometimes salty snacks, sugary snacks, and fatty snacks, fatty food. We go back at home in the evening, and therefore the changes in lifestyle as we become more urbanized. And for instance, in Kenya, we are talking about by 2030, 50% of us will be urbanized. We are seeing that transition from rural areas into urban areas as also leading to these lifestyle changes and exposing ourselves to increasingly to non-communicable diseases. I would like to point out that in Kenya, we're still talking about communicable diseases, which really cause high levels of morbidity and mortality. But what we are also saying is that if we do not begin to address non-communicable diseases in the next 20 years or so, by 2030, when we want to be industrialized, we'll really be dealing with a high burden of non-communicable diseases. What can we do as Kenyans to prevent? Because the management of these conditions is very expensive, and also you really don't want to start treating people with hypertension. We don't want to start treating people with diabetes. These are chronic diseases. They are very expensive to manage. They really cause a lot of mental health problems. They lead to depression. So what can we do to prevent? And the entire meeting we are having, and that's why Greg is in town, is to address issues around prevention. What can we do as Kenyans to prevent these conditions from a population perspective? What can we do as individuals? How can we change our diets for those who are really exposed to consuming high sodium, high fat, high sugary foods? And what can we do in terms of knowing our own health status now and do something to prevent from developing these non-communicable diseases?
Well, definitely there is a need for us also to, like you've mentioned, understand how we can prevent, then later on start dealing with a population that's really affected by non-communicable diseases. Well, the big issue segment, we'll take a short break. When we get back, we'll look at other factors that have led to persons getting non-communicable diseases. So don't go away, stay tuned.